If you're in a really good program at a large enough hospital where patients interact with other patients and in support groups, you get to know what to expect.
You go through a psychological exam, you go through a nutritional exam, you're talking with a variety of counselors.
That's one of the reasons we talked earlier about preparation. We want them to develop all the good habits and think about developing the good habits and realizing they're doing them, not try to recover them 3 years from now.
You're talking with medical doctors along the way, all preparing you to see if you will be a successful candidate.
Other people will tell you what they went through right after surgery. And so there should really be not too many, huge surprises if you're not running into physical problems.
I went through the classes and I lost 60 pounds before I had the surgery. And like I said, the accountability, I went every week. I reformulated how I thought about the diet.
And there were all these procedures that you had to have an endoscopy, a colonoscopy.
The nutrition classes were actually more support than just, learning classes, which was wonderful for me. I did have to rearrange my thinking.
There's an enormous amount of prep work to get even to the point where you can get scheduled for surgery.
I had to go to a psychiatrist. They had to tell me I was sane. Oh, duh, I'm fat, not crazy.
By the time somebody comes to see me, I'm usually one of the last steps because they've usually been cleared medically and then they need the psychological aspect. So I'll usually meet with somebody at least 2 or 3 times before I will consider them to be a good candidate or not.
I had to go through behavior modification classes. How are you going to do things differently? It taught me a lot about myself. It really did. I had to really deal with some issues that I didn't want to deal with.
You couldn't get the procedure if you didn't work with all these different people. People who I know that just went to a surgeon, I've observed that sometimes they are not as successful, and they're not as successful both in losing the entire amount of weight they wanted to lose and in keeping it off.
Sometimes when people come into the support group meeting, after listening to them talk for a few minutes or that evening, I can sometimes tell whether they're really going to be successful at this journey or not.
And I think the biggest part of my pre-surgery journey was actually talking to other people who had had surgery. And that's not always easy because people have very varying degrees of success around surgery. Some people are able to keep the weight off, some people are not.
They're not willing to make the changes. They're not willing to do what's being laid out in front of them to do.
It is a comprehensive approach. Otherwise, there is no way at my age that I would have been able to change 55 years of behavior and chronic disease and obesity.
I wanted to talk to the people who were struggling because I wanted to know where the pitfalls were and where I could hopefully avoid them. So my journey into surgery was more a mental journey, I think, than a physical one.